Hello, we are going to be talking about abnormal liver function tests. So I'll probably break this down into different parts just to break up the different areas. This is quite a commonly requested test and there's a lot of different things to go into, so it'll probably be a good one to do as a first video. So in liver function tests, you get different components, which is usually ALT, ALP, bilirubin, and albumin. Now, the way that's good to think about, I think, is what do these areas represent, basically? So, ALT is primarily contained in the liver hepatocytes. So, if ALT is raised a lot more than the others, or it's raised in isolation, you're kind of pointing towards an hepatic sort of cause or picture. Now, the second enzyme, ALP, is more so concentrated in the biliary tree. So specifically is contained in the bile epithelial cells. So if ALP is raised a lot more, then you're thinking more of a sort of biliary cause, or some people call it sort of an obstructive pattern, for example, or cholestatic pattern. So that's a good place to start off with, ALT and ALP. So which one's higher? Which one is it? Is it just either one of them alone that's raised? The other test that can provide a clue to what's going on in all of this is bilirubin. So bilirubin is produced via the breakdown of red blood cells or heme, and then it's bound and taken to the liver for processing, where it's conjugated. So once bilirubin is conjugated in the liver, it's excreted down the bile ducts into the duodenum, which causes the stool to be the color it is, basically, and the urine to have its color as well. So there are different causes of raised bilirubin. So you can get pre-hepatic cause. For example, if there's hemolytic anemia, so there's an increased production of bilirubin, or there's hepatic causes, so issues within the liver, and then there's post-hepatic causes, so once it's sort of pushed out from the liver. For example, if there's an obstruction somewhere causing a backlog of bilirubin, that would be a post-hepatic cause. So if the bilirubin is very high, you're sort of thinking, is this an obstructive jaundice? As an example. So we'll go into that a bit more later as well. Now, albumin is reported as well, and that is something that's synthesized in the liver. So if that's down, it suggests there's some chronic issue with the liver. So it suggests that there might be some chronic liver disease going on, or there's malnutrition, but it takes time for it to drop. So usually in the acute conditions, you may not see that's an issue. So this is sort of the rough kind of way to differentiate different conditions, but there is a lot of overlap, and you're almost sort of trying to put the different elements together to form a picture of what's going on in the sort of bile ducts, the liver. Now, there are a lot of other causes that are not primary liver or bile conditions that can affect the liver function tests. So another good area to look at is medication or drugs. So that's something that can affect ALT or liver function tests as well. So that's something that's quite good to look at. There is, for example, with ALP, there is ALP contained in other areas of the body. For example, the brain, the bones, in pregnancy via the placenta or breast tissue. So raised ALP could be related to other conditions of the body, but a good way to differentiate if it's to do with the liver or if it's to do with some other area of the body is to do something called a GGT. So if GGT is raised, then it suggests there's a liver issue going on rather than something else. But it's also a good idea to get a vitamin D or a bone profile done just to check if the ALP is kind of going down that route. Now, we mentioned about bilirubin having other causes as well, like for example hemolytic anemias. So next we're going to talk about different conditions which can affect the liver function tests.